Thank you for choosing Minneapolis Heart Institute at Abbott Northwestern Hospital. We are here to take good care of you. Now that you and your doctor have chosen open heart surgery, it is time to begin planning for your hospital stay. Your appointment with the pre-operative clinic will help you prepare for open heart surgery.
Could walk before you started having symptoms.
With good planning before your hospital stay, you can focus on getting better once treatment begins.
You want to fill your lungs up completely?
Surgery instructions are provided for you to help make planning easier. The surgery instructions outline what medical appointments need to be done before surgery, how to manage your current medications, what to bring for your hospital stay, and what preparations need to be done before you arrive at the hospital. Open heart surgery requires an incision in your chest. Surgery can be divided into two groups, on-pump and off-pump. On-pump surgery makes it possible for the surgeon to operate when your heart is not beating. With on-pump surgery, a heart-lung bypass machine performs the role of the heart and lungs by circulating blood and oxygen throughout your body. Off-pump surgery is done while your heart is beating. Your healthcare team will work hard to keep your blood loss as low as possible. Despite this, you may need a blood transfusion during or after surgery. You and your surgeon will decide on which blood management plan is best for you. Good communication among patients, family, and caregivers builds the foundation of a quality healthcare experience. To make working together easier, each member of your care team wears a name badge, as well as a specific color of uniform. Refer to the Know Your Care Team guide to identify team members, as well as how they may help you. Good teamwork depends on good coordination. A white care board is located in each patient room for easy access to important information, such as your nurse's name and phone number, and upcoming appointments. Your care board is updated as your care plan evolves and at shift changes. We will use a care map to chart your care and recovery. Your care map is a guide to what you can expect, as well as goals to help you return home. Discharge day is measured by your progress on achieving these daily goals. Everybody's experience is slightly different, but the care map identifies the important milestones of your care and recovery. Your family, friends, and loved ones are important partners in our healthcare team.
No pain.
Hi again.
We recommend you choose one lead person as family liaison during your hospital stay. This person would then keep your support team updated on your progress as needed. Please ask questions. By working together, we will achieve the best outcome possible. Once you arrive on campus, enter the main public parking ramp located next to the Heart Hospital. Valet parking is also available. Take the parking ramp elevator to level DE, which opens to the second floor skyway area. Walk down the second floor hallway towards the Heart Hospital registration area, labeled H2000. The receptionist will check you in. After registration, take the elevator to the third floor. A reception liaison will greet you and help with any other needed details. You are now ready to wait in the patient family waiting area. When it is time for your surgery preparation to begin, you will be escorted to a pre-operative care suite, also called the PACU. Nursing staff will help you get situated in your room and answer any questions you may have. After you change into a hospital gown, a nurse will insert an IV line into your arm for fluids and medications. Your surgeon will come to see you, review the procedure, and have you sign a consent form. You are now ready for surgery. Family may accompany you up to the doors that lead to the operating room. From here, they will return to the waiting area. We request that at least one family member stays in the waiting area during your surgery. In the operating room, general anesthesia will keep you asleep during surgery. An endotracheal, or breathing tube, is placed through the throat to keep your airway full and clear for breathing. A chest tube is inserted to drain any blood, fluid, or air from around your lungs. After surgery, you will be transferred to the intensive care unit, or ICU. Your family will be notified and meet with your surgeon. In the ICU, the nursing staff will monitor you closely. When you first wake up, you will be unable to speak due to your breathing tube. Your breathing tube is typically removed 4 to 8 hours after surgery. Your heart monitor will stay connected for continuous observation by your healthcare team. Do not be alarmed by any machine beeping sounds. These sounds are typical during the monitoring process. Your care team will work hard to help manage any pain you experience. Your nurse will ask you often about your pain.
So it'd be mild. So it'd be annoying and nagging.
Tell the nurse if your pain is not under control. Unmanaged pain may delay your recovery. It may take 1 to 2 hours for you to get settled into your ICU room. When you are ready, we will reunite you with your family. You will be quite tired on the first day of surgery and may not be hungry. We will work with you to meet your nutritional needs. You should be able to sit up in bed or in a chair with help by end of day. Your comfort level will depend on several factors. Refer to the care map for a complete list of what to expect on your first day of surgery.
So we're going to start feeding you more solid food.
When your care team determines you are ready, you will be moved from the ICU to a telemetry patient room. Your lead family liaison will continue to keep people updated on your status. Breathing exercises using an incentive spirometer will strengthen your lungs and be helpful to your recovery. Recovery will continue with a focus on cardiac rehabilitation exercises. Little by little, you will have more energy. Together, you and your family will learn more about caring for yourself after surgery. Your comfort level will depend on several factors. Refer to the care map for what to expect on the days after surgery.
Like maybe you're right here, about a 6 or a 7.
If you have pain, tell your healthcare team. Your input will help determine the right medication and therapy to manage the pain. There are other treatment options for pain in addition to prescription medications. Your healthcare team will work with you during your stay to prepare for discharge. Many details must be coordinated before you leave the hospital, such as diet plan, medications, rehabilitation schedule, and follow-up appointments. Make sure to ask any questions you may have.
Hi, how are you doing?
Recovery from heart surgery doesn't happen overnight. We will be with you each step of the way. Thank you for choosing Minneapolis Heart Institute at Abbott Northwestern Hospital. We are grateful you are taking action to improve your health and wish you a good recovery back to your normal life.